Good afternoon, everyone. Thank you for joining us for this session today on World Hypertension Day. So basically, it was observed on the 17th of May this year with the theme, Measure Your Blood Pressure Accurately, Control It, Live Longer. I am Richa Shukla. I'm the head of Clinical Nutrition Department with an experience of more than 2 decades in the field now. And we have a expert of panelists here who are renowned nephrologists and cardiologists who are going to help us in understanding about hypertension. We all know, often known as silent killer, this is something that is affected more than billions of people worldwide, which is hypertension, and especially the youths. So we need, it's a cause of concern, a very critical topic. So we have taken this session today. So I would like to welcome all my experts here today. Dr. Ambike sir, he is a highly experienced nephrologist with over 4 decades of experience in the field, specializes in treating kidney diseases, organ transplants and dialysis. We have Dr. Ajit Mehta. Sir is senior interventional cardiologist with more than a decade of experience. He focuses on advanced treatments for heart health. And Dr. Vikrant Khese, he's an expert cardiologist with over a decade of experience in managing and preventing heart diseases. So welcome, sir. Let's start with the heart of it, straight to the heart of it, or rather, shall I say, the blood pressure to it. So the first question would be very basic. I would ask Dr. Mehta, why is hypertension known as silent killer, sir? What makes it like so dangerous? What are the things or concerns one needs to keep in mind?
Hi, everybody. On a day, on the day of Hypertension World Day, I would like to tell you a few things. I mean, I'm going to discuss about the hypertension, how we can prevent it. But as we all probably know, that hypertension is known as a silent killer. And why it is known as a silent killer? Because unlike the other diseases where somebody is suffering from a particular disease, the signs and symptoms are seen immediately. But unlike those diseases, hypertension generally goes unnoticed for many years or sometimes in decades also. So somebody who's suffering from hypertension, high blood pressure, probably is even not aware that he or she is suffering from a high blood pressure for many years, unless the complications, unless the target organs are already affected because of the long-standing hypertension. And there are not many symptoms which are noticed with the hypertension. Somebody who's suffering from blood pressure about 150, 140, which in turn called hypertension, but may not have any symptoms to tell that person, he or she, to take medical advice or to take antihypertensive medication. So it is known as a silent killer. And why killer? Because if the blood pressure goes unnoticed for a long time, it can start affecting multiple organs in the body, be it heart, brain, kidney, eyes, and then probably by the time patient reaches to us, it's too late and patient has already had a target organ damage, and that's why it is known as a silent killer.
Right. So, sir, when you're saying this, are there any warning signs that one needs to keep in mind? Because, like you said, the signs and symptoms are very unnoticeable for a longer period of time. So, if left untreated for a longer period of time, what can be the serious implications of it?
I said, generally there are no signs and symptoms of hypertension, but if really one has to really see what could be the signs and symptoms of hypertension, the commonest would be the headache. Then sometimes people would feel dizzy because BP is very high. They might feel dizziness. Sometimes they would experience breathlessness on exertion or chest discomfort. So these are few symptoms which are not particularly specific to high blood pressure. Somebody who has a headache can be said as a migraine. Somebody who has a dizziness can say he's not had food, or probably sugar has gone down, or probably not hydrated well. So there can be overlap of these signs and symptoms, but may not be a particular sign and symptom of the hypertension. And that's precisely the reason hypertension goes undiagnosed for many years. And by the time it comes into light, sometimes it is too late. I mean, patient has already had a target organ damage. Sometimes, Dr. Ambike would agree with me, they come with a young chap, no other history, comes with a renal failure, end-stage renal disease, and then needs dialysis. But then when we go back into his past history, we realize patient was suffering from hypertension, or probably has had hypertension earlier, which went unnoticed, and now has presented with a renal failure directly.
So very, very important and crucial point to be noted that these kind of simple things like, constant headache or chest pain or any kind of these issues should not be taken lightly, but we should be screening ourselves for it. Coming to Dr. Ambike, so what could be the risk factors which are primarily probably leading to hypertension? Are there some modifiable ones that one can look up to so that we can prevent hypertension?
Basically, what we talk about hypertension is we try to divide them into two broad categories. One in which we don't essentially know what the cause of hypertension has been. Basically, this is the one which is most troublesome. We have secondary causes which are hormonal, which are endocrine, which are secondary to kidney diseases. So the ones which we talk about are the essential hypertension, or the one which gets picked up without any other cause as such for the hypertension. Now the commonest cause is the changing lifestyle. All of us are now having a very changed lifestyle. All of us have changed our lifestyles. We have do a very sedentary type of work. The food that we eat is also probably contributing. Excessive salt in the diet also adds to occurrence of hypertension. A very small percentage of our hypertension patients would have, as I said, the secondary causes, wherein you have endocrine causes, which we shouldn't probably be going into because the treatment doesn't change. And sometimes we can find out a cause which can be treated, where in the blood supply to the kidneys, if it is hampered, then we probably correct the blood supply, like in patients with renal artery stenosis. But by and large, most of the patients who present to us with hypertension, we cannot identify the cause. The investigation that we try to find out is whether there is some underlying kidney disease which is the cause of hypertension, because basically it is the inappropriate handling of sodium and water by the kidneys which leads to hypertension. So primarily quite a few of our patients do have kidney disease as the cause of their hypertension.
Okay, absolutely, sir. And so we have established one thing, that hypertension is silent, yet it is going to have an impact slow and steady on your body. So let's understand and each and every aspect now in little more detail. Let's take up heart first. Of course, knowing that Cupid is not just the one aiming for it, it could be hypertension also. Dr. Mehta, I would like to ask you, can you walk us through how high blood pressure impacts the heart directly, and what are the serious issues and complications it could lead to?
By and large, high blood pressure can affect multiple organs. So heart is one of them. Then comes the brain, kidneys, and eyes. These are the 4 or 5 main important systems which are affected by the high blood pressure. So when it comes to the heart, it could be a heart attack. What we call as a coronary artery disease is one of the major risk factor. Hypertension being a major risk factor for the coronary artery disease. So what we in generally call layman's term is a heart attack, or patient who needs eventually angiography, angioplasty, bypass. So those kind of problems can be seen with a long-standing untreated hypertension. The other problem related to the heart could be heart failure, the most important problem. Sometimes patients, the heart pumping, the ejection fraction, what we call, normally 60%, starts dropping over a period of time because heart has to pump against that much of a high blood pressure in the vessel. So eventually heart fails, and then once heart fails, the ejection fraction drops significantly, and patient presents with the symptoms of the heart failure. So there are multiple other cardiac related issues that may come with hypertension, like heart failure, coronary artery disease. But generally, we cannot segregate each organ. Hypertension patient will only come with this. Generally, most of the other organs are also associatedly damaged. So person who has a heart failure may, because of the long-standing hypertension, may also have a kidney problem, and it's a vicious cycle. A kidney problem increases the blood pressure further damages the kidneys, and so on. So basically, it's not only going to limit a said patient to a heart failure, but it may involve kidneys, it may involve patient may having stroke, or bleed in the brain, what we call is an intracranial hemorrhage. That also sometimes happen because of the high blood pressure, or peripheral vascular disease. Patient is not being able to walk after walking said distance about 500 meters or 1 kilometer because they start getting pain, angina in the leg, what we call as a claudication. and of course the retinopathy. Patient has not been able to see because of hypertensive retinopathy. So these are the multiple commonly known organs affected by high blood pressure.
So definitely when you're saying it has to be treated, it has to be followed. All the treatment protocols suggested and advised by the doctor and experts have to be followed religiously so that you don't, get complications or, concerns or issues related to it. Sir also mentioned about lifestyle changes, about exercises, about diet, about all these factors. But I think there is a lot of other things also other than physical factors. There are a lot of, mental or you can say emotional factors which are involved here. So I would like to ask Dr. Khese here, what role does stress play in high blood pressure? Are there any practical strategies that one can keep in mind, or do you recommend something that one can do?
Definitely, stress does affect hypertension or blood pressure. Usually, a short-term stress releases stress hormones like steroids and adrenaline that rises our blood pressure and heart rate. In a chronic state, this is mimicked by our body, and in long-term, patient may develop hypertension in this state. So surely stress affects blood pressure. Other way to correct is doing regular exercises. It keeps the mood elevated, gives you confidence. That is one way. Other way is guided meditation, yoga can help you to calm your nervous system. Then having a poor sleep pattern adds stress to your body. That improving your sleep pattern and good amount of sleep helps. Keeping social connectivity helps you to relieve stress. Talking to your family, friends helps us to relieve stress and reduce some amount of, this changes may help with check the blood pressure, reduce the blood pressure by 5-10 millimeters at least.
Absolutely. So when you're saying this, is this a part of our treatment protocol also that we advise the patients on these aspects?
Whenever a patient is diagnosed with hypertension, first thing is advised is lifestyle modification. So that after, if it is not treated with lifestyle modification, then we comes with the pharmacological treatment. So lifestyle modification is very important and has to be followed.
Absolutely. So having said that, definitely I would like to have a point or input here, because we have spoken on exercises, we have spoken of lifestyle modification. So diet cannot be overlooked. When it comes to diet, sir said, the kind of salt intake that is there in our diet is very important, because we all know, like Indians, we are really including a lot of salt in our diet. There are studies which show that we are eating around 9 grams or 8 grams of salt. However, the WHO recommendations are only 5 to 6 grams. So the diet approach would be a DASH approach for hypertension, which is dietary approach to stop hypertension. And when we say that, basically it incorporates controlling on sodium or salt-rich food items and increasing potassium, calcium and magnesium-rich foods in the diet. When we say that on a broader aspect, the food groups are that you need to include more of fruits, vegetables, pulses, legumes, whole grains, and try to include more of nuts and seeds in the diet. Try to curb down on the processed foods. Excess salt and sugar in the diet is what you need to keep in mind. Also, just one more thing, that you need to be controlling the amount of alcohol and caffeine in the diet, because there are studies which show that excess intake will impact on hypertension and it increases hypertension. Next is, let's have a connection move towards kidney and hypertension, sir. So we know kidneys are our unsung heroes, so would say and elaborate more on it, because they work 24/7 without even talking about kidneys all the time, right? So, sir, how hypertension can harm our kidneys, and what are the risks of developing chronic kidney disease because of hypertension? How high is the risk, sir?
Hypertension, in fact, is one of the commonest causes of chronic kidney disease. Along with diabetes and hypertension put together, almost about 50% of our patients would be having diabetes and hypertension as their cause of chronic kidney disease. Now, primarily, basically, hypertension is a disease of the kidneys. As I initially said, it is primarily because of the mishandling or inappropriate handling of the sodium and water, which starts accumulating as a result of kidney disease, which starts or begins off or kickstarts the process of hypertension. So controlling hypertension is an important task or an important factor in controlling the worsening of kidney disease. And it is, as Dr. Ajit rightly said, it is a vicious cycle. So uncontrolled blood pressure is going to harm the kidneys, it is going to reduce the kidney function, it reduces the glomerular filtration rate by causing sclerosis of the filtering apparatus, and that in turn worsens the kidney function. That by itself increases the hypertension. So it is a vicious cycle, and the two cannot be separated. They are not, they are absolutely, they go hand in hand.
So what you're trying to also mean is, sir, it is not always hypertension that leads to chronic kidney disease. Is there any reverse thing like a CKD?
It is in fact the other way around.
Okay.
It is basically the kidneys which do not, or which are not capable of handling the sodium and the electrolytes, which causes hypertension. And if that goes unnoticed, if that goes uncorrected for a period of time, that worsens the kidney function.
Yes, sir. I always remember that sir used to always mention to me, hypertension is not a cardiac disease, it's a kidney disease. Yes.
The brunt is borne by the heart.
Yes, and the brunt is
one
borne.
rushes to a cardiologist once they get to know that it is someone is diagnosed with a hypertension.
Absolutely, sir. So I also want to know how essential is it to keep screening then your kidney functions, and how one should have an approach towards screening.
See, now quite a few hospitals do have their health packages, which I would suggest are very good. Meaning, as a part of the package, routine blood tests are done, blood pressure is monitored, and if someone is detected to have hypertension on a routine screening, they should follow up with their physician, with their primary care physician, and keep their blood pressure under control. After someone is diagnosed to have hypertension, we need to find out what kind of an end organ damage has it already caused. So we normally, as Ajit Mehta doctor said already, the 4 organs that normally get affected are the kidneys, the heart, the brain, and the eyes. So as a part of routine, a urine routine examination is the easiest and the simplest and the cheapest test that anyone can do to see whether the kidneys have started getting affected. The earliest marker of urinary abnormality is proteins start leaking in the urine, which should not be present in the urine, and that by and large predicts the damage of the kidneys that have happened because of the hypertension. Then later on in the disease, the blood parameters start getting worse, the kidney functions, the renal function test, they need to be monitored, and once in 6 months, if everything is normal, is what is recommended to keep things under control. And we now fortunately have drugs which can reverse if they are picked up in the initial stages, meaning before the damage is already set in. We have drugs which will reduce the amount of protein in the urine. We have very good drugs which can control the blood pressure in the ideal range, and the lower the better is as far as the kidneys are concerned. So the target should be having a blood pressure of systolic around 110 to 120 and a diastolic of about 70 to 80 with whatever measures that you can do.
Right, sir. So, sir, do you think, what is the recommendation of salt intake that you recommend, sir, at these conditions?
As
How
you have
much of
already
salt should we?
elaborated, yeah, meaning about 2 to 5 grams of salt over 24 hours is what is recommended for someone who has been diagnosed with hypertension. Most of our Indian diets are much higher than that, so we would need to insist upon our patients to take a low salt diet. Absolutely salt-free diet is not very much recommended because it doesn't become palatable in the long run. So you have to advise to your patients things which are going to be lifestyle. Meaning when we talk about lifestyle measures, they are meant to be continued for life. It is not like I have followed a lifestyle measure, I have done yoga, I am regular with my exercises for a month, and after a month I don't follow the lifestyle measures. So whatever is feasible and which can be caused, so a diet of about 2 to 5 grams per day of sodium chloride is what is recommended, which is not really very unpalatable also and is easily manageable. So we advise our patients to take less than 5 grams per day of salt.
Right. So 1 teaspoon of salt per day is what is recommended by the dietitians and the doctors also. What one needs to know is salt is not your best friend there. but the herbs, spices are going to be your best friends, because believe me, friends, it is, if you add oregano, that is not going to have an impact on your blood pressure. So please add on more herbs and spices rather than using salt. Coming towards numbers now, let's understand, how do we understand the numbers here, sir? So is there any, like you said, blood pressure range for hypertensives? So is there a blood pressure range for normal individuals different for hypertension individuals that one needs to keep in mind? And how often should be checking the blood pressure if we are a hypertensive also?
There is no different blood pressure for a hypertensive individual, meaning people have a myth that for my age and for my this thing, I've been a hypertension, so if I reduce my blood pressure to the ideal, which is about 120/80, it is not good for me. So the targeted blood pressure would be around 120 to 130/80 for any individual, and that should be maintained with whatever drugs that they need to take. If you are well controlled with your blood pressure medicines in the range that is recommended, once a month follow-up is what is essential, and that is what we advise our patients to follow up once a month.
So, Dr. Mehta, would you like to add on to it in case there is something through AHA recommendations or anything for, blood pressure range for hypertensive?
Yes, Dr. Ambike said, you like to have blood pressure for any age, any class, be it hypertension, be it kidney disease, heart failure, any systolic less than 130 and diastolic less than 80 should be the ideal blood pressure for most individual at any point of time. So that is the most ideal blood pressure to have it. And anything more than that, now there used to be a term called, high normal, when they were in a range of 130 to 140. So probably those are the people who should be, look out for more frequent blood pressure checking, for a lifestyle modification. Probably they still don't need a kind of a pharmacological medical treatment, but once it crosses 140, yes, certainly a patient needs to be on a oral medication to reduce the blood pressure. But somebody who's in the range of 130 to 140, probably we can manage this patient on lifestyle modification, as we have been all discussing about low salt, DASH diet, a lot of fruits, and potassium, calcium, all those kind of diet to reduce the blood pressure naturally. And believe me, if somebody follows this over a period of time, it cannot happen. You can't see the effect overnight. But if someone follows this kind of a diet, lifestyle modification, quit smoking, reduce alcohol, regular exercise, reduction in the weight, so all this comes under lifestyle modification. If somebody does it, it's as good as giving one tablet for the blood pressure. So it can reduce the systolic blood pressure by about 10 to 12 millimeters of mercury, and a diastolic blood pressure about 5 to 7 millimeters of mercury. So probably if you catch hold of these people early in the stage, probably we can just manage them with a lifestyle modification.
Is there, sorry, please continue.
And as we were saying, how frequently somebody should check their blood pressure. So, it goes with, family history. Somebody who has a strong family history, both parents are hypertensive, or a strong family history of a cardiac or a diabetes or kidney problem, they are the one, they should have, early checking of blood pressure, even from the earlier age, even if, they have no symptoms. So, the family history also plays a major role in a high blood pressure.
I think the audience would also like to know if there is a certain time of the day that we should be checking our blood pressure. Does it have any impact early morning or during the day? What do you advise?
No, as per the circadian rhythm, the morning blood pressure surges are always known, and then evening, when somebody who's office working comes home tired, have a lot of stressful day, the evening blood pressure are going to be high. But said that, there's no kind of a recommendation from the governing bodies. You check blood pressure at this and this particular time. How you should take blood pressure is very important. I think probably all of us are aware of that. The cuff should be the appropriate size. Patient should be comfortably sitting, sitting or relaxing for 10 minutes before taking the blood pressure. Not had smoke 10, 50 or at least 1 or 2 hours before that, not had tea, coffee. So all those things you need to follow before taking the blood pressure. See, somebody who just walked in, walking about 7-8 kilometers, and you check the blood pressure, is definitely going to be on the higher side, So that blood pressure is not valid to call that person as a hypertensive. So you have to make that patient relax, let him relax for 10-15 minutes, and then take his blood pressure in a sitting posture with the cuff size, appropriate cuff size, keeping it at the heart level. So all those things are important when we are checking the blood pressure.
Okay, fantastic, sir. We'll be discussing more when we come to blood pressure monitoring at home. Also, I would like to know from Dr. Khese that are there any myths which are floating around? When patients come to you to your clinics, what are the basic myths that they kind of sometimes come up with, and how do you really counsel them and speak to them about it?
There are so many myths. With this social media, we get so many patients telling us random things. Most common thing is patient says if one's blood pressure is controlled with the medicine, he's cured. So most commonly we find, but this is not the case. When blood pressure is controlled with the medicine, it has to be maintained. It has to be monitored. If it is it's checked, and then if it is going down, then only we can stop the medicine. Or the other thing is patients say that if there are no symptoms, we don't require treatment, which is very wrong. As Ajit sir was telling about silent killer. That is the most poor thing. Not treating that hypertension will affect all the organs.
Okay, so there are many more, because when people come, they just come up with any question. To my clinics, when the patient comes multiple times, they ask me, "Sir has recommended this medication, but do you think I should have the medication, or shall I just start with diet and exercise for a month and then I can think of starting the medication?" Whether it is diabetes or whether it is hypertension, very commonly asked. Dr. Mehta sir, how would you address this very commonly asked? Can lifestyle really replace the medication? That's very important that we need to emphasize on to the audience there.
No, as I said, lifestyle cannot replace the medication. That's what I was just, saying sometime back. Person who is in a, a pre-hypertensive stage where the blood pressure is in the range of 130 to 140, probably lifestyle can make a huge difference in this population. But sometimes the blood pressure is 160, 170 systolic. Of course, over and above lifestyle, medicine is required. So, it's not, replacement of a lifestyle modification to drug or drug to lifestyle modification. It's complementing each other. What we need to understand, it's complementary effect. The lifestyle first, of course, modification followed by the drug medication if required. And let your doctor who is treating you, let him take a decision whether that said particular patient needs blood pressure tablets or only lifestyle is going to be good enough for him to manage the blood pressure.
So you wanted to add something?
One more question which most of our patients ask when they get to understand or when they try to understand that these medications which are going to be started are going to be lifelong. The second question that they pose up is, do they have any side effects? Are the drugs that you're giving me, are they going to harm my kidneys? They ask this question to a nephrologist who is probably going to take care of their kidneys and going to advise them drugs which would help preserve whatever kidney function is. They come up with side effects before they are probably wanting to get convinced that these drugs are going to help them. So side effects is a fear which has been probably instilled in the minds of our patients, that allopathy means side effects. So they are willing to go to any length or try out any other measures, trying out bhasmas and Ayurvedic medicines and kadas and all that. They will not question about the side effects of these drugs, of the measures that they would take. So when they get to know, when you try to break it to them that these are medicines apart from your lifestyle measures, which of course you would need to continue, these medicines are meant to be taken lifelong. The second question that they pose is, if I am going to take this lifelong, what are the side effects that I am going to have?
Also,
what I
sir,
wanted to add when we were talking about the myths of the treatment that is involved in managing patients with hypertension.
Right, sir. And also, multiple times they want to know, how does the medication go down? Suppose, for example, a person is on medication for hypertension and the medication is helping, the lifestyle is intervention, is also helping. So, how do you titrate it and lower it to also sometimes get reverse? Is it possible?
It is definitely possible. That is the role, or that is the reason why we advise them for regular follow-ups. If someone is, say, obese, if someone did not have a very good healthy lifestyle, if someone was not very compliant about his diet, then obviously if all these measures are taken care of, then it is not necessary that the patient was probably on, say, 3 different types of blood pressure medicines. If the blood pressure is more than controlled or more than what is desired, we obviously would down titrate the medicines that the patient has been started upon. But then the need is to try and achieve the recommended or whatever is advised control of blood pressure.
Absolutely. And also that you need to have regular follow-up and not do anything on your own, only after your expert doctor has advised you to do the same.
Yeah,
that
that
you
is
can
one
try.
more thing that needs to be impressed upon our patients, that they need to come for regular follow-up, meaning a prescription which is given today is not valid for a lifetime. Every month that the patient comes to me, is his other parameters are being looked into, his blood pressure is checked, and if everything is going on, many a times the same prescription gets continued. But that doesn't mean that the patient needs to continue the same medicines or the same prescription lifelong.
Right, sir. Right. Point noted, sir. Next question would be to Dr. Khese. What is this mysterious white coat hypertension? There is a terminology called as white coat hypertension, and how it can be accurately diagnosed. What is it?
Yeah, so white coat hypertension is that parameter or entity where blood pressure, patient's blood pressure increases when he comes to the clinic or office BP, what we say. So this is because of fear, stress of what patient gets. So this can be corrected by doing a home blood pressure monitoring in a correct way, in an accurate way. Multiple home readings can help us to diagnose this white coat hypertension. Other way is there is a ambulatory blood pressure monitor available, which measures blood pressure 24 hours. We take the average of that blood pressure and we decide if he's hypertensive or not. The advantage of this ambulatory BP is we get to know about the nocturnal dipping also. Usually everyone's blood pressure dips by 10%. So those who are non-dippers have also has a risk of having hypertension in the future. Also, they are candidates for lifestyle modification and treatment sometimes. So ambulatory BP is that one thing which is very underused by most of the people. Many people don't use it. So this is one thing that should be done on yearly basis or whenever we try to monitor or titrate our treatment.
Right. So how many numbers do we really see when it is this white coat hypertension what you're talking about,
There
sir?
is no exact number for the white coat hypertension, but some patients may give you higher numbers, more than 170, more than 170, 100, but there is no exact definition for white coat hypertension blood pressure measure.
Okay. Now, since you put up this point of accurately monitoring it at home, and even sir was mentioning it earlier, I would like to ask you, sir, about how and what one should do while monitoring blood pressure at home. We know there is a hypertensive at home and they are monitoring their blood pressure on their own on the BP machine now. So how it needs to be done, that is one that was partly addressed by Dr. Mehta also. And what do you think should be important? Are there any risks involved when it is not done correctly at home?
One or two things about this. One is now we have quite a few digital instruments that can monitor the blood pressure, and they are fairly accurate. But the important thing is the cuff size has to be appropriate. The way it should be snugly fitting the arm. It has to be at the level of the heart. So if someone is monitoring it in the right way, there is no harm in monitoring or measuring the blood pressure at home. And in fact, as Dr. Vikrant said, we do advise our patients, if someone is saying that he has a white coat hypertension, we advise them to take blood pressure at home. But many a times what happens is they get fixed with that idea and they get very much concerned. So that by itself can affect the blood pressure. So home blood pressure definitely has a role in monitoring. But ambulatory 24-hour blood pressure monitoring would probably be a better idea to monitor their blood pressure at home, wherein you have a more objective and all these fallacies or all these man-to-man the problems that can happen in measuring the blood pressure can be taken care of. So we have most of the hospitals now have 24-hour ambulatory BP monitoring, which gives us a better idea of what the blood pressure is at home.
So that is better advice to do that. Next is, we've understood about what are the causes, risk factors, importance of screening, how should one be monitoring the blood pressure and, keeping a check and tracking it regularly. We need to also know that hypertension plays a very important role when it comes to different life stages. So I would like to ask you this question: what about high blood pressure during pregnancy or gestation? And what are the risks that it can pose later on? And if you can suggest how can one be managing it easily?
pregnancy-induced hypertension or hypertension occurring in pregnancy is a different topic altogether by itself. There are a few women who are prone to get pregnancy-induced hypertension in their second trimester, and initially when in their routine antenatal visits, they have, by definition, they develop this hypertension in the second trimester. But then many a times what happens is they are not registered with any antenatal clinic, and they may be hypertensive to begin with, which was detected during pregnancy. So those are a different, totally a different group of females who have been just detected hypertension during their pregnancy. It is important to control blood pressure throughout their pregnancy to have a good outcome as far as the fetus as well as the lady or the mother is concerned. So the targeted blood pressure again is the same, meaning 110/80, because the blood pressure tends to drop during pregnancy, especially in the first trimester. So, but one important thing is not all drugs are safe during pregnancy. So during pregnancy, we need to choose drugs which are not going to adversely affect the growth of the fetus, the malformations of the fetus. So all that needs to be monitored. One more important thing is to label someone as having pregnancy-induced hypertension is they need to follow up after their puerperial time or after about 6 weeks of pregnancy, wherein all the changes that have happened or occurred during pregnancy tend to get reversed. So if someone has hypertension, which someone meaning a pregnant lady who has hypertension beyond 6 weeks of pregnancy, it does not limit, or by definition it is not a pregnancy-induced hypertension, and it will merit the same consideration as what a normal non-pregnant woman would have. So we need to follow up these patients even after pregnancy. So after the purview of the gynecologist, they need to see the physician and follow up to see whether that hypertension was only pregnancy induced or it was the beginning of a essential hypertension, which will need to be treated accordingly.
Okay, sir. Now, another aspect of lifestyle intervention or lifestyle love story, when we say two classic villains are alcohol and smoking. So I would like to ask Dr. Mehta, sir, what do you think these habits, alcohol, smoking, how they can contribute towards worsening high blood pressure or hypertension in an individual?
So basically, when we talk about smoking, people just consider it's a cigarette smoking. But smoking, when we talk about smoking, is tobacco in any form, be it cigarette, be it vaping. Now people are fond of vaping or e-cigarette or what you call hookah. Everything comes under one banner. It's a tobacco. So basically, when we talk about tobacco and alcohol, how does it adversely affect, health conditions, especially the hypertension? So the nicotine in tobacco, it causes vasoconstriction, the constriction of the arteries, which is responsible for the increase in the blood pressure, causing heart attack, causing brain strokes and multiple things, So it causes vasoconstriction and in turn leads to high blood pressure. This is a, kind of acute who's just smoked or probably has a tobacco. In a long term, there are multiple chemicals which are released by the tobacco in the body, and that adversely keep affecting the endothelium, the lining of the blood vessels. And that over a period of time, causes shrinking or the vasoconstriction of the arterioles, leading to stroke, leading to high blood pressure, heart attack, heart failure, retinal problems, peripheral vascular diseases. So this is how tobacco, nicotine, in short, in any form would affect the overall health of a person. When we talk about the alcohol, anything in moderation is okay. I'm not saying good, but if somebody crosses that moderation of using alcohol, it also has a bad effect on overall health. When it comes to hypertension, alcoholic patient generally tends to have a higher blood pressure levels when they take it for the long duration of time and excessive alcohol. So both alcohol and nicotine can adversely increase the level of blood pressure on a chronic usage.
Itself.
So, the content of the wine sometimes does help, improve the good cholesterol in the heart, controls the bad cholesterol in the heart, has got, vasodilatory effect on the...
Which one are we talking about?
Red wines. So, basically, in a moderation, it is okay to have wine, but person who doesn't drink wine does not mean that person has to start drinking wine to have a better beneficial effect on the heart. There are better ways to, have a good effects on the heart and other things more than starting. I mean, I'm not recommending people not having wine to have wine, but people who have wine in moderation, it is okay. But moderation is very important. Otherwise, over a period of time, people, lose that, threshold or the moderation line and then cross over. And it's a J-shaped curve, what we call in alcohol. With moderate use of alcohol, the incidence of the cardiac problem do come down. But if the usage goes up, it's again the cardiac events, because of the high blood pressure, cardiac events go up. So it's a J-shaped curve. But, it's a very thin line. So I think people who don't drink, please don't drink. People who have, definitely go out to moderation.
So fantastic, sir. And more than that, I really feel, sir, you need to know how much of alcohol by volume are you consuming. So the units of alcohol is very important. The frequency is very important. And what you eat along with the alcohol is most important. So like sir said that, little bit in some units, which is an allowed unit, may be fine. But if you're eating all sausages, all fried pakoras, and all fried chicken and all those things, or mutton with it, definitely it has a bad impact on your cardiac health and cardiovascular health as well. So, we have spoken about mostly all the aspects that probably our audience would be interested in it, but not talking about the latest technologies and the AI. We being sitting in this, world now of AI, everybody is talking. Are there any applications or any platforms that that one can use to track hypertension and monitor as well? Or is there something else that you would want to advise when it comes to that?
When it comes medically, I think, there are multiple applications, multiple softwares available for people to, track their heart rate, blood pressure, sugar and everything. But, honestly, when it comes to a cardiologist, we have been dealing with this kind of problem. But when we ask our patient to follow with, this kind of application, especially for the heart failure patients, not for the simple hypertension, because it can be misused in some time. So what I tell my patients, they either overdiagnose or underdiagnose their own condition, start treating themselves, which is in a way not a good idea, So what I tell them, a simple thing, have a, simple electronic BP apparatus at home. Check your BP, give them the range. This is your range you should have your blood pressure into. Crosses more than this or less than that, probably you should go and see your doctor. The only important thing what I want to mention here is, we are making people aware or probably involving them in their own treatment of the hypertension. That is very important, more than the actual reading of the blood pressure. Honestly, it is 138 or 140. 140, he needs a treatment. Medical treatment. 138 doesn't mean he doesn't need it. It's just 2 millimeters mercury low. But scientifically, yes, he can be off medication. But it's a matter of 2 millimeters. But that's what I'm trying to say. The absolute value doesn't matter. Somebody who's aware that he or she has a blood pressure, checking their blood pressure value regularly means that person is involved in his own management. So more than just relying on all those new fads, new things, now this smartwatch came in a big way initially. People were so happy, Apple has got a smartwatch, you can track your ECG, heart rate and all those things. Believe me, every day I get at least one panic patient coming to the OPD. My heart rate was 38 in the middle of the night. My smartwatch beeped and showed 38. When I was running, my heart rate went down to 160. It is going to be there sometimes. So how you use all these gadgets, AI based and whatever we are saying, has to be used very, very carefully, and let your doctor, physician decide whether that said particular person needs all these gadgets or not. A person who is just 130, 80 BP, he doesn't need to monitor his blood pressure. If he's active, doing all lifestyle modifications very well, don't have to check your blood pressure every single day.
Right, absolutely, sir. And then people forget that all these applications say we have our sleep tracking, we have our ECG tracking, etc. Very soon we'll have blood pressure tracking on the phone. But what we don't stop is ordering food from phone, which is we are ordering French fries along with doing all these things. So we need to make those modifications also when it comes to it. Now time for some practical wisdom that we want to know. So just 30 seconds, sir, each one of you. What would be your practical advice or suggestion to the audience today in 30 seconds?
Unfortunately, hypertension is on the rise. It needs to be detected early. It needs to be controlled well. In the beginning, as every one of us highlighted, lifestyle measures do have a role to play. But when it comes to taking medicines, the more religiously you take it, the better it would be to prevent you from getting organ damage, permanent kidney disease, heart failure, coronary artery disease. So early detection and long-term continued compliance with controlling your blood pressure in the normal recommended range is what is advisable for every one of us to prevent you all from reaching us.
I totally agree with you, and I would just emphasize more of a diet here. We are all aware everything is available on the Google. We have been, Google follows religiously. I would just say, people underestimate the importance of diet or lifestyle modification. People will have to take that more seriously, and believe me, it has a effect, or it has a potency of having giving somebody one blood or two blood pressure medicines if somebody follows their lifestyle religiously. That comes the most important: weight reduction, being active, physically active, the most important thing, a good healthy diet. There are 7 days in a week. Generally, most of the people eat twice a week. You eat 14 meals in a week. Somebody would always say, I'm the most sannyasi in you, I want to enjoy my life also. Fair enough. Out of 14 meals, somebody can eat 13 good, disciplined, homemade meal. One can be a cheat meal. There also you can, make sure that you are not added too much of salt or oil or some rubbish thing in that. So you can enjoy life also. There is no reason for a hypertensive, diabetic, or any health-related condition patient to just go off your kind of a good lifestyle. You can measure everything what you do in life, and you still can enjoy your life. That's what I would like to say.
My message would be more to the young population and a middle-aged population, where I would like them to, especially those with risk factors, family history of heart disease, hypertension, diabetes, and those who are not symptomatic, be more aggressive with their routine checkups, yearly checkups, not only blood pressure but also sugar, cholesterol, these things to be monitored more aggressively in these patients. So if they are not symptomatic, they might find out and they may act much earlier.
Absolutely. Thank you so much. So the message is loud and clear that even though hypertension is silent, but it is not shying away, and when it comes to causing damage, it could be severe, slow and steady, but severe. So we all need to be really watchful of our numbers, check our numbers, get our blood pressure monitored, have healthy habits when it comes to diet and exercise, and also keep monitoring that. Plus, when it comes to stress, meditation, yoga, all these things need to be followed, and probably a healthier lifestyle is what one needs to be modifying. Keep in mind that it has to be sustainable as well, and not just a short-term, quick goal that one needs to achieve. I would like to thank my expert panelists here for their session and invaluable time for the session, and thank you to our audience for attending it. In case of any queries or any doubts that you have regarding the topic, please feel free to reach out to any of our experts here. We are available in Jehangir Hospital, so whether be it any screening, whether be it prevention, whether be it treatment protocols, we'll be happy to help. Thank you so much. So this is us checking out for today.